The mayor of Sacramento, and I want to welcome you to another Facebook Live. I hope everybody had a good and a safe weekend. I want to bring into the show, as they say, right away here, Lisa Bates. And I want to introduce you to Lisa. Lisa is the CEO of Sacramento Steps Forward, the nonprofit organization that is tasked with working with the city and the county to alleviate the crisis of homelessness in Sacramento County. Lisa, welcome to you.
Thank you. Happy to be here this evening.
Thank you so much. This is really an important part of my job, to be able to have public discussions with people I work with every day, but a leader who is on the front lines of the homeless problem in Sacramento. Lisa, first of all, just real briefly, your background. How did you come to this position? And tell us what Sacramento Steps Forward does.
Sure. My name, Lisa Bates, again. I have about 25 years of experience in community development, affordable housing, and homelessness efforts throughout mainly the county of Sacramento. I started my career with Sacramento Housing Redevelopment Agency, working in many of our communities when redevelopment was around and still in play. I've spent the last 6 years at the state in leadership positions for the Department of Housing and Community Development, doing, again, a lot of housing and homelessness policy, affordable housing development, financing. And I've been with Sacramento Steps Forward, came back to the local scene about a year now, about a year or so. I've been with Sacramento Steps Forward and really appreciate the ability to be back on the ground, taking advantage of a lot of resources that are coming from the state, being able to deploy them and think creatively about how we can solve the homelessness situation here in Sacramento.
And what does Sacramento Steps Forward do? Tell us, a lot of people may not know what Sacramento Steps Forward does.
Sure. So Sacramento Steps Forward, we are a nonprofit entity, and we are wholly involved and responsible for trying to bring solutions to ending homelessness within the county of Sacramento. We are officially given a HUD designation as a lead agency for what is known as the Continuum of Care. Now, Continuum of Cares may not be well known by most people that are listening, but they exist across the nation. There's in fact 44 of them, I believe, in California. And so we are the lead entity that's supporting the Continuum of Care, which is really a body of nonprofit and public sector organizations that are all in some way touching the issue of homelessness. So it includes our city and county officials, it includes law enforcement, it includes education, employment, behavioral health, people that have lived experience. All of these represent on our board, which meets monthly, and we're tasked with, one, just being able to understand the issues of homelessness in the community, and that's done in a couple of ways. One is by identifying how many people are homeless and who they are. You may be familiar with the point in time count that we do every other year. That's one way that we are able to get a handle on Sacramento's situation. We also look at how services are being coordinated across the city and the county, and we do that through a very robust database system. So any provider that is providing services is logging that information into a system that then gives us information about how folks are experiencing services that this community provides. We also work with the Continuum to plan for the future, and particularly to figure out how to best invest both federal and state resources that come to this region, and particularly to the COC. We administer a number of federal funding sources too that are provided to homeless service providers to help ensure that housing is continued to be available for folks that are unsheltered or experiencing homelessness.
One more.
And we work very collaboratively with the city and the county on all of those efforts.
That's what I was going to get to. Before we get into the heart of the discussion here about what's going on with homelessness and COVID-19, just one more bit of foundation, because I think it's important for people to know. As you know, I've made homelessness, reducing homelessness a major priority of my mayorship, and have raised a lot of money at the state level and privately, and put forward some significant city resources as well. The city is not a health and human services agency. The county of Sacramento is actually the Health and Human Services Agency. And then you have Sacramento Steps Forward. Describe briefly how all three entities work together to try to make the homeless problem better in Sacramento.
Well, and I actually think the effort that we're going to talk about today is a really good example of that collaboration and the response team that has been established to address COVID-19. So Sacramento Steps Forward is able to, again, provide a lot of table setting. We're able to provide good data that helps inform you as a council or the Board of Supervisors in decision making. We also are working collaboratively on coordinating entry into housing. So we really try to prioritize the most vulnerable people in our community with the match them to the best resources, whether that be permanent long-term housing with services or whether that's more short-term interim housing. We manage a whole system to help support that larger infrastructure that the city and the county are supporting, whether it be through sheltering services or rehousing or permanent housing services.
So I want you, if you would, to describe the state of homelessness in Sacramento pre-COVID. If we were having this discussion, say, on February the 1st, what would you say about the extent of the problem, but also the efforts being made from both the city, the county, and the Sacramento Steps Forward side in terms of trying to help people end their state of homelessness and get their lives back?
So our most recent point in time count has been reported in the news and generally known is we have over 5,500 people that are homeless on a point in time that we counted in January. And we can see that we have 10 to 12,000 people experience homelessness throughout the year. So largely that population is also unsheltered. So we have a significant problem and it is continuing to increase. We saw a 19% increase in homelessness since the last time that we did the point in time count in 2017. So, many efforts have been underway in the last year and a half. The council has taken very bold steps to stand up or begin to fund a number of shelters that are in various stages of being ready for deployment. You have your Capitol Park Hotel shelter that is up and running at the moment. The county has invested quite a bit in rehousing. So they are currently implementing a flexible housing program right now that will rehouse 600 folks that are unsheltered. And they've launched that program and they're seeing steady amount of rehousing happening every week. The Continuum of Care, we are continuing to invest in system-wide improvements that help make that coordination more efficient, more effective. And we also have resources that we just received from the state that will begin to be also deployed for both rehousing activities and prevention type activities in the near future or as a part of this COVID response, which is something I'm sure we'll talk about in a little bit.
Yeah, pre-COVID, a lot of money coming down from the state of California. That's where most of the money for this new approach is going. One more, and then we're going to get to COVID. People have sort of a traditional definition, maybe a stereotypical definition of what a shelter is, a long-term place for people to sleep. Sacramento has begun changing the definition of what it means by shelter. Can you talk about that a little bit, how shelter is no longer intended to be a long-term place for people to stay, but a place instead to get stable, to get the services that they need, and eventually to move on into a more permanent setting? Maybe I just answered my own question, but go ahead.
I think you did, but
okay, sorry.
The triage centers that the city has been investing in. I mean, the ultimate goal is to make sure that people are safely and stably housed. And so to the extent that we can make that transition from being unsheltered to housed as quick as possible is our goal. So yes, there is the need for sheltering to bring people in, to help connect them quickly to services, get that identified what their needs are, but hopefully transition them fairly quickly so that their stay in housing or in sheltering, is as little or as minimal as possible, because the ultimate goal would be to have people permanently housed and in a place where they're not having to keep transitioning.
So you've, I think, described very well the state of homelessness and the efforts both from the city and county side pre-COVID. The city is in the process of constructing a number of 100-bed triage shelters in addition to our existing shelter beds and shelter system. We've got about 700, right, already between the city and the county. The county is taking state money that has come down. They're using it to lead on rehousing people from the shelters or from the streets into more permanent housing. And the numbers that we are ready to stand up would be in the hundreds. And the idea is that if we can get people out of the shelters relatively quickly into permanent housing, those hundreds can multiply 2 or 3 or 4 times over the course of a year, and we can begin getting to the larger volume. Then COVID-19 hits. And so let's talk about what has occurred over the last 5 months, how the city, county, and Steps Forward are working together in an even more urgent way to address both the COVID crisis for homeless people, but also homelessness in the broader sense. Go ahead. What have we done?
So in a few weeks ago, we went both to the Board of Supervisors and the City Council with a pretty comprehensive COVID response plan, $15 million in funding. And really it is a 3-prong approach to ensuring that we, one, have the safe and health, safety and health of our folks that are experiencing homelessness, help stop the spread of the COVID-19 virus, so that it is protecting not only those that are homeless, but also our broader population. So with those goals in mind, the 3-pronged approach that we have developed includes really sustaining our existing shelter system. So we have a number of shelters that are continuing to operate in the safest possible manner following CDC guidance. So making sure that our current shelters can remain open and able to be responsive to the need. The second thing is standing up a number of new sheltering opportunities, which is referred to as the motel rooms, 850, potentially up to 850 motel rooms. The trailers that the state has offered us that are now placed at Cal Expo, so that we can be able to be responsive to those that are most vulnerable in our community and have the highest risk of potentially contracting or spreading the virus. And then the third thing that we're doing is really reaching out to our unsheltered community with a pretty robust encampment strategy. There's some guidance from the CDC that indicates that people that are out and unsheltered in encampments, largely larger than 10, may be in a safer condition than coming into a congregate shelter, as long as they maintain appropriate social distancing, have access to appropriate resources and good hygiene. So we have that 3-pronged approach that we're taking very urgently and very quickly. We're in our 15th day of having housed or sheltered our first client under this response. So the team worked incredibly hard in the weeks prior to really stand up a very complex and complicated effort.
And I really commend your team, the county team, the city team, for really taking this on with everything you got. Let's go back to the basics here for a moment. So you talked about the trailer strategy, the motel strategy, and expanding the existing shelters to create the social distance where necessary. How many new beds then in Sacramento have we made available to ourselves as a result of the COVID crisis? Well,
to date, we have opened 263 motel rooms, and we have
I'm going to go back here. How many beds do we have available to us in total? It's close to 1,000.
As part of the plan.
Yes.
Yeah, so the $15 million that was endorsed by the COC, the City Council, and the Board of Supervisors contemplates that we could get close to 990 capacity if it's warranted, and we're continuing to see that as we expand our categories for who we're serving, we're seeing the increases in our of who we're bringing in to be sheltered.
Okay, so let's break it down here. 990 beds, and that could those rooms, I should say, not beds. 990 rooms, and those rooms could include couples, correct?
Correct.
Okay, so the number of actual people could be over 990, depending upon the number of couples, right?
Yes, and
Okay.
Families as well.
Families as well, so it could be significantly higher. And the idea is for people to be in these motel rooms and or trailers for how long?
Well, maybe I should talk a little bit about the distinction between the different options.
Go ahead. Sure.
The trailers that we have at Cal Expo are largely to serve folks who have been tested and have been determined to be positive, or they're still waiting a test to confirm what their situation is. So those are medically supported, have more intensive services and medical resources. Luckily, so far, this community has only seen a handful of individuals that have tested positive. But the idea is that we need to have medically isolated places in the event that we do see an increase in the number of people who are testing positive or who are under investigation. The motels are largely for quarantine, and those are for folks that are, we've expanded the categories, we've been doing that every week, but largely for people who are symptomatic, who are over 55, or have pre-existing chronic health conditions. And so those are the eligibility criteria for who we are serving now, that the public health and the CDC has determined to be most vulnerable and most impacted by the virus, potentially.
Okay, so go ahead. I was going to say 850 motel rooms for those who have not tested positive or not suspected necessarily of being positive. The trailers are for those who have tested positive or those who are suspected of carrying the virus, correct? Is that an easy distinction?
Mm-hmm.
Okay. Yes. All right. And so how many people in really a week plus of implementation have we been able to get in the hotel rooms, the trailers, and the expanded shelters combined?
We are probably, around 170 between the trailers and the motel as of today. And we see that number increasing every day that we are open. So we're seeing a steady incline in the number of folks that are moving into the shelters. We've had probably around 20 or so into our shelters. I don't have the exact number, but it's somewhere around that.
And how are people going from the streets to the motels or to the trailers? What's that process? How does the outreach work? Who's out there that wasn't out there before?
So maybe I could talk a little bit about the encampment and outreach strategy and
Sure.
then fold in the answer. So with our encampment strategy, again, our main goals is to make sure that people that are out in encampments or unsheltered are in safe conditions, sanitary conditions. So there's a number of things that we have initiated. One is making sure that we can deploy sanitation stations, which are basically porta potties and hand washing stations throughout the county of Sacramento, where we see large concentrations of encampments that don't have access to restrooms or washing stations. So we've deployed about 40 toilets and a similar amount of hand washing stations, and we continue to site and continue to deploy each week. We are providing food to all of our encampments. We were able, through the generous Donate for Sacramento effort that I know you're leading along with Sierra Health, we've been able to support the provision of meals through Loaves and Fishes on a daily basis, as well as one of our community partners, Sacramento Covered, has been providing meals. So around 650 meals a week are going out to our encampments, and we expect that amount to increase. We're also working with medical students that are volunteers from UC Davis and California North State University. And they are going out with our workers on a daily basis. So there are about 40 outreach workers that go out every day from various outreach entities. Sacramento Steps Forward is one. We have others, Sacramento Covered, Self-Help Housing. And as our outreach workers are out and encountering people in the various locations, they're able to do an assessment and help refer people into the motels. So we have a number of referral partners that we're working with that include the shelters themselves, homelessness providers, our outreach teams, law enforcement is also included. Our medical partners, our hospitals are also referring in clients into the system and into the motels and the trailers. So
and what about transportation? How are any of these outreach workers, whether they be law enforcement or the doctors or the providers that serve the homeless year round, how are they transporting people from a tent encampment to one of the motels or the trailers?
So the Department of Health Services from the county was able to secure transportation services through one of our ambulance services in the community, because we need to be careful about making sure we're following proper protocols for transporting people who may be symptomatic or who have a test pending or positive. So we have engaged that organization to help us. And so to the extent that transport is needed, we're able to arrange that right when we're making the referral into the various locations.
Okay. So I want to get to one of the key issues involved in this effort, and that is the relationship between, and maybe the tension between, the fact that this is a COVID-19 response, that is essentially the criteria by which the federal government has said, we'll reimburse you for bringing people indoors because we don't want the problem to spread among the homeless population. And the pre-existing homeless problem that we have had for a long time. Because while the first priority, rightfully and understandably, is for people who are COVID positive or who are symptomatic, the criteria also allows the program to bring people in who have pre-existing fragile health conditions, even if they are not suspected or do not have COVID in this instance at this time. Can you talk about how you see that tension, if you will, and how we merge a COVID response with an overall homeless response to bring more people indoors?
Well, I think it is true that a lot of the money that we received from the federal government and the state is directly to help, address the COVID-19 response. And so we've been very careful working with public health to make sure that our prioritizations and our categories are consistent with the populations that those particular agencies have guided us to. And so we've largely met and actually now are exceeding some of that criteria. So whereas the CDC says 65 and older, we're at 55 and older. We've just opened it up to anyone with pre-existing conditions. So we're continuing to move and make strides to reach as most of the vulnerable people that we can through this response. And we have the resources that we've dedicated through July. So partly the tension is that this is a very limited term, short-term strategy with limited resources. And to your point, what happens after that? And what are we going to do to address, after, and nobody can predict yet where we're going to be in July either.
But I want to stick to this point for a moment, because one of the things you said in the early part of our conversation is that Sacramento Steps Forward is the data entity for homelessness in Sacramento, and you provide us with a lot of the technical information around the point in time count. And so, while again, this is all being done in response to COVID, as you just said, and I know I've been pushing this, and I appreciate the fact that you and the city and the county are moving in this direction, that the criteria for being able to go into the hotels includes people who have no COVID symptoms, who haven't tested positive, who might be of any age, not just older, but people who have fragile or pre-existing health conditions. That's right. I said that accurately, correct?
Yes. Mm-hmm.
Okay. From your experience and from the data, are people who are chronically homeless, who have been out there on the streets for some appreciable period of time, by definition, do they live with fragile health?
Most chronic homeless people do have a chronic health condition. That by nature, that's the definition. Partly it's how long they've been out on the street, but it's also that they have a disabling condition, and that can be a mental health condition or a chronic health condition. So by its nature, chronically homeless individuals do experience a lot of pre-existing health conditions, no question. And as we have been working on this program, we are seeing that a number of people likely have pre-existing conditions that we're referring in.
Because here's my hope, and here's my hope, and I think it's the hope of the community as well. We got to follow the rules, and we have to follow the criteria, and this is public health driven. And it is also going to be overseen by FEMA, since they are going to provide a significant amount of reimbursement. But if people with fragile health are also more likely to be carriers of the virus, or to have or to get sick themselves, then I hope that we are able to move aggressively towards filling those 990 beds, because beyond those who just might test positive, and hopefully there are very few of them, or those who have a fever or actively sick, that we have an opportunity to get 1,000 people or so, or more, depending upon family units, off the streets under the umbrella of COVID, even if they don't have COVID. Is that your hope too?
Well, our hope is that we're being as responsive as we can be to the COVID-19 pandemic. I think we want to be very careful and methodical about how we are approaching this, and I think we have been. Every week we have adjusted the criteria and broadened it, getting closer to where the population is that you're suggesting, Mayor Steinberg. The other thing I just want to also maybe throw in here or keep in mind is we are just now starting to test in our shelters. And so these are folks that are sheltered, but we have largely not done any testing in our shelters. That's beginning this week, and public health will start seeing results later this week. We want to make sure, as we are thinking about who we're putting into the motels and as we're expanding capacity, that we're looking at the entire environment and landscape. So if we're starting to see that we have a situation where some of our shelters are seeing positive cases, we're going to have to pivot to help address the de-intensification of the shelters. And so that will have an impact too on our overall capacity. But I mean, I'm just wanting to share that there's to look at relative to how we're housing or sheltering and leasing up the various motel rooms.
Yeah, you need to make sure that you always have capacity in case people do test positive, and they need to be isolated. I completely, and it is a bit of a balance. But you know, my desire, and you know, I get to say this stuff because I'm the politician and the mayor, and so I get to sort of say it freely, and you're very transparent and open, but you're also very clear that, you know, there's a protocol and guidelines to follow. And I think you and your team and the city and county team are doing it very well. But I can say that I believe we should leave none of these beds or none of these rooms unused during this period, because there are undoubtedly, if that number is point in time count was 5,570, there are undoubtedly, and let's just say 100 people test positive, and hopefully it won't be that many. That would still leave another, almost 900 beds or 900 rooms, excuse me, that there are enough people who meet that definition, who are either older or have a chronic health condition, that we should be able to use the financial assistance of the federal government, all the money we've gotten from the state, and we ought to get as many people under a roof as we can. And I know that's where I think we are heading. 173, I think is what you said, at a 990 after a little over a week. Not bad. We still have a long way to go. And I know that I check in on those numbers every morning. And I just think there is an incredible opportunity for us to do what we have all wanted to do for a long time. And that is to get people off our streets into safer places, into healthier places where they have a greater chance of being able to regain their health, their safety, and their dignity. But I'll get off my soapbox for just a moment here, because I want to go to the other key piece of this, which is both, again, an opportunity and a challenge. I asked earlier, and I just want to reiterate it again and see if we can. The idea is that people stay in isolation, either in the motel rooms or in the trailers, for a limited period of time, correct?
Well, definitely in the medically isolated trailers, they're in there for a limited period of time, and then they can step down into the motels, into the quarantine situation. How long people can stay in the motels is really going to be a factor of what our demand and our capacity is. And then as you had alluded to, and I'm sure we'll talk about, what is going to be the exit strategy for folks, because certainly having folks go back out into the street would be an unfortunate solution. So needing to look for opportunities for how we are continuing to be able to either shelter or rehouse individuals beyond the limited term.
Right. We all recognize what an unacceptable outcome actually it would be to bring people in for 60, 90 days and then to not have thought through or work towards trying to find as many longer term or permanent places as possible. On May the 5th, we are going to bring to the City Council, through our Housing Authority and our City Housing Department, a set of options around how we could rapidly set up rehousing solutions for people once they exit the motels and the trailers. From your time and experience, why don't you talk a little bit about that? What you think the city and county and Steps Forward should be doing, and how we can make this project not just a temporary success around homelessness, but a longer term success.
Well, the response team has already started looking at things, particularly in terms of what are our existing programs and how are they operating? What resources do we have currently? What resources might we need to think about if we were to have a really robust rehousing or exit strategy from the shelters? So it's likely going to mean some hard choices financially, I would assume, and real thinking about how we can get very creative about serving the most amount of people with most efficient resources. And so I know that we're actively looking at rehousing strategies. We have been in conversations about, as I know you are having SHRA look at motel acquisition strategies, and is there the potential to acquire motels and keep them more long-term as an interim housing solution. These are all things that we're looking at. And I would just say that the COVID response team effort, the fact that you have the city, the county, and SHRA that were able to come together very quickly and stand up this effort and have continued to work collaboratively, we need to do that same thing as we look to the broader homelessness solutions, right? I think this has been a great opportunity with lots of learnings about how we've been able to stand up an effort very quickly. And so we're now pivoting to look at, okay, what does that mean in terms of a really appropriate rehousing strategy? But it's going to not be easy, and I think it's going to come with some challenges in terms of costs and resource decisions.
Yeah, opportunity and challenge. And you are right. And I want to highlight that. I also want to thank all the community-based organizations that are out there that have been working so hard, because without them, all of us in government would not have the partner to be able to actually do what needs to be done on the streets. It's really heroic work. I mean, just like the healthcare people on the front lines, the homeless service providers, the outreach workers, the men and women of the police department, all of them are out there interacting with a very vulnerable population, and doing so in compassionate ways, but in ways that are trying to help people get a better situation than just living in the cold and now in the heat. And they deserve a shout out as well. I go back to FEMA, which is the Federal Emergency Management Agency. They have committed, at least through the end of this month, and I'm sure it will be extended, to reimburse a lot of our costs, at least the costs that we're incurring either locally or through our state funding, 75% of the costs. And so when we get that reimbursement, I hope that we can bank that, so to speak, and use it as the beginning of our source of funding for the rehousing portion of how we get people from motels and trailers into more permanent settings. And we continue to fight for more federal stimulus money, of course, direct aid to cities and counties. The city of Sacramento was very fortunate because our population is 508,000. We met the threshold from the third stimulus. We received a wire transfer, not a check, a wire transfer for $89 million last week. And certainly homelessness is one of the eligible uses of that money. That's another potential source for rehousing the people that we are getting indoors. Closing thoughts, Lisa, about what you've learned from the last 5 weeks. Has it changed your belief about what's possible, what's doable in this very difficult arena?
Well, I definitely have witnessed just amazing work, as you mentioned, not only from the larger community and all the willingness to just dive right in and help support, but really from the staff of the city, the county, my own organization, just really being able to coalesce and gel in a very quick fashion, in a very collaborative manner, has been actually pretty inspiring for me as an agency that is supposed to be somewhat sitting in the middle of all of these entities. And so my hope is that we take these learnings that we have in standing up this program and trying to address housing sheltering our most vulnerable, that we continue that for the broader effort for the community. And I think we can, and I think we will, and we're already moving in that direction. So we appreciate the opportunity that this has presented us. Even though it's a horrible situation that we're in, but I think we'll learn a lot from that. That will make us stronger and more integrated and coordinated as a community and as a city and a county going forward. So I'm very hopeful that we will be able to continue to do the good work and continue to be able to address the situation and the problem that we have at hand.
I have no doubt of the same. And it is a real test not only of our abilities to work together, which I agree, I think the city and county have come together like never before, which is a great benefit because we're going to need to continue to do so. But, and there's no but to that, this is the long-term effort, of course, is going to reveal our potential here. But the next 3, 4, 5 weeks are every bit as important, because this is the window where there is real attention being paid. This is the window where we actually can gain significant amount of reimbursement, again, to reinvest in continuing the effort. And I just appreciate your drive and our continued drive together with the city and county to do it in the right way, but to make sure that we don't leave any of these resources and these beds, these rooms, these gifts, really, on the table. And so we go forward. I think it was very, very informative. I hope that the people of Sacramento understand a little bit more about the detail of how this effort started, what its requirements are, what some of its challenges are, but most importantly, what a great opportunity we have to make the biggest dent we've ever made in a problem that has vexed us for a long, long time. Thank you so much, Lisa. We'll talk to you again soon.
Thank you.
Okay. Good night, everybody. See you Wednesday.